The name of the book is Vegetation Over Medication. So just to give you guys a little bit of background, I can tell there's some new people here, and that's always a good thing too. So coming into the new year, I see there's a new people. So again, my background is I went to school to become a pharmacist, and so I was a clinical pharmacist at the hospital. I also worked for the FDA. I also worked for food companies. And so I healed myself of high blood pressure. I was diagnosed with high blood pressure when I was 16. And this was despite the fact that I was an athlete. I only had about 5% body fat. And so I chalked it up to heredity. I thought there was no way I can get rid of high blood pressure. And I actually was telling patients this every time they picked up a prescription. They would ask so what do I need to do to get off the high blood pressure? And they taught us in school that there's no way to do that. And so I told them that because that's what I believe, even for myself, having high blood pressure. And so out of desperation, I adopted a plant-based lifestyle and lost 45 pounds and reversed my high blood pressure, got rid of a lot of inflammation in my body, and changed my life, and it changed my perspective on healing. And so I left, my job, took a job in Japan where I studied a group of people who lived to 100 in Okinawa, and die in their sleep and eat a plant-based lifestyle. And so after leaving there, I traveled the world: Peru, Honduras, Thailand, China, all parts of Africa, and learning with herbalists and holistic doctors, and came back here where I wrote the book Vegetation Over Medication, because I believe that if you're properly educated about food and herbs, you will understand that they heal your body because they're in alignment with the nature of your body. And so that's why I named the book Vegetation Over Medication, because, medication is what you take when you refuse to eat the right things, when you refuse to live the right type of lifestyle. That's what happens. And I'll be the first to tell you, if I step off the corner and I get hit by a bus, take me to the hospital. Take me to the hospital and save my life. But for chronic illnesses, anything like that, that's what nature does its miracle work. That's what's in alignment with our nature, our body. So that's what the book is about. And I talk a lot about the myth, lies, and truths behind modern medicines and modern foods, because 90% of the food that you walk into the market and see today did not exist 50 years ago. Okay, so we're dealing with pseudo foods, frankenfoods, and we're calling them foods, but they're really not foods. So that's what my whole philosophy is: detoxification, superior nutrition, and then sort of the whole mind, body, spirit thing, holistic living. Yeah, so the one, I'll drop a gem before I get out of here, but the important thing I want you guys to know and understand about health is our bodies are really capable of healing themselves. I've had the fortunate benefit of witnessing this with every disease from cancer to the common cold. And I'll admit, when I first started my personal journey, my whole idea was I just want to heal my high blood pressure so I don't end up having a stroke or have a heart attack in my 30s. That's what I didn't want to do. I didn't want to have a heart attack or a stroke and be paralyzed in my 30s. And so that's what really inspired me to change my lifestyle. Okay. And when I went plant-based for 60 days, and it changed my weight, it changed how I looked. I had a visible neckline. My skin tone was different. My attitude was different. I knew at that point that changing your diet could affect those things, but I didn't have diabetes. I didn't have, cancer. I didn't have high cholesterol. So I didn't know if it really could change those things. But since that time, 2010, when I started my journey, I've worked with people individually, and they've had everything you can see in a hospital, from fibroids to fibromyalgia to Crohn's to MS to lupus, I've worked with those people, and I've seen them being able to turn their health around using plants. And I can tell you, I filled hundreds of thousands of prescriptions in my time working in the hospital. And I never seen one medication do that. I never seen one medication cure the common cold, much less high blood pressure or lupus. Okay? And so that's what inspired me to change my whole philosophy and walk away from modern medicine. And that's what inspired me to return back to the original medicine, which is plant medicine. And so that's why I am where I am today. And I want to inspire people and help people understand, because there's been a war on natural medicine since the early 1900s. You know, modern medicine, drugs that we know them as today, didn't exist 100 years ago. You know, prior to 100 years ago, there were no drug companies and things like that. It's a very new phenomenon, okay? And I talk about this in my next book, but that war that started on natural medicine, it started on natural medicine because guess what? Plant medicine can't be patented. You can't patent an orange or apple. You can't patent soursop leaves. You understand? You can't patent burdock. You can't patent dandelion root. Those things can't be patented. And because you can't patent it, you can't make a lot of money from it. And so because of that, what drug companies decided to do was, I'll make a synthetic version of what plant medicine does. And because I make a synthetic version of that plant medicine, now that can be patented. Okay? Case in point, a drug called Digitalis, which is used for, heart abnormalities. That drug is based on a plant known as foxglove that they use for heart arrhythmias. Okay? So they take the plant medicine, foxglove, which you can look up, and then they create a synthetic version of it, Digitalis. Okay? And now that can be patented. Okay? And then what they do is they create this synthetic version over here and then go to war with the plant-based version of it and say this plant-based version is dangerous, it should never be used. And now you think to yourself, like, I would never use this plant-based medicine because, like, the FDA said don't do it, my doctor said don't do it. But the truth is, they don't teach us about those things in school. They don't teach us about plant-based medicine in school. So we have no idea what plant medicine is. Only thing we know is what we Google, okay? Unless you come out of school and start to know for yourself, start to educate yourself. So you have to understand, a lot of the times when you're asking your doctors, in many cases, because some doctors are now coming along, just like myself, but in many cases, when you're asking your healthcare professional what you should do as a natural alternative, they're giving you layman's perspective. They're giving you Google information because they do not teach us that in school. We do not have to take any nutrition classes when we're in school. It's not required. You understand? So we don't have to take any herbal classes. It's not required. So we do not have to take any dietary courses. So when you're going to your physician, in many cases, again, I'm one of those people who decided to educate myself, but everybody doesn't take that route. And so it's really important to understand that in many cases, when you're asking your healthcare professional advice on diet, they're just as ignorant as you are about the subject, okay? If you look up what is the number one cause of death for a cardiologist, which is a heart doctor, the number one cause of death for heart doctors is heart disease. So that tells you that they don't really know what the cause of heart disease is. That tells you that they don't know about nutrition, because nutrition is the number one cause of heart disease. You understand? So like there's a huge gap in between understanding what treatment is, because treatment is, I give you a pill and you have to take that every month for the rest of your life. That's treatment. There's a huge difference between that treatment and healing. Healing is You're healed. You no longer have to take anything. You have your health back. That's why the first few letters of healing is like health. We don't have health care anymore. We have sick care. That's why when you go into the doctors, if they can't figure out what's wrong with you, even though you know something's wrong with you, they will send you home. Okay. And I've seen people, go into the doctors, get labs taken, stay overnight, and they're like, we don't know what's going on. And the next day that person goes home, has a blood clot that ruptures, and then they had a stroke, or they had a pulmonary embolism that caused them essentially to suffocate and die. Okay? It's because we have sick care. We can't really treat people in the hospital until we see something that shows up wrong. That's sick care. That's a sick society. You understand? We don't have health care. Health care is how I keep you healthy. Health care is how I teach you how to prevent disease. Meaning you come in with high blood pressure, then I teach you what caused you to have high blood pressure. And then I show you how to prevent high blood pressure. That's health care. Health is not the absence of disease. That's a very narrow definition. That's a very small standard of health. The absence of disease is not health. Okay? That's a very small requirement. That's 1% of health. Health is being able to have bowel movements. Health is sleeping properly. Health is an adequate amount of energy. Health is a very strong immune system. You understand? Health is the ability to breathe properly. Most people, when I work with them, I tell them to take 5 deep diaphragmatic breaths, meaning they take a breath that goes so deep it goes down into their stomach. Most people, when I tell them to take those 5 breaths, they get lightheaded because they're not used to taking deep breaths. We're not even breathing correctly. So everything we know about health today is backwards. It's not what we were taught. It's not how this body actually works. It's not how this nature that we call a body is built to work. It, in many cases, is quite the opposite. It doesn't even work like that at all. And so that's why it's so important to understand. That's why I named the subtitle of my book is The Myth, Lies, and Truths About Modern Foods and Medicine. Is because a lot of what they're teaching us is just the opposite. Like this whole pandemic, they've been telling us to wear a mask, shelter in place, and wash your hands. Now, I'm not saying anything is wrong with those, but all I'm saying is if you get COVID or you get any type of infection, it will not, wearing a mask, washing your hands, and staying at home will not help you. It will help other people so that they don't get the virus or whatever, but it won't help you. They haven't talked about the importance of vitamin D. They haven't talked about the importance of your gut bacteria because 70 to 80% of your immune function actually is made in the gut. Okay? They didn't talk to you about the importance of magnesium. They didn't talk to you about the importance of sunlight. They didn't talk to you about the importance of, being adequately hydrated. Nobody mentioned any of those things. This whole entire 10, 11 months that we've been going through a pandemic. And so when people are saying, oh, now we have a solution. We have a solution. We've been working on it the whole time. It's called a vaccine. That's going to be the thing that works. Okay. But it takes, in a matter of weeks, you can actually reestablish healthy gut bacteria inside of your gut where 70 to 80% of your immunity is made. Okay. That's in a matter of weeks. We haven't been told that the entire time. And so I always tell people it's important to understand you have to be very careful about trusting people who haven't given you correct advice in the first place. They don't give you correct advice about the very minimal things. Like they don't give you correct advice about high blood pressure, let alone something like this. And so you have to be very cautious about who you allow to dictate your health. My whole point is You need to reclaim your own health back into your own hands. Stop allowing other people to dictate how you're supposed to heal, because there's always already a plan in place in terms of how you heal, how your body heals. And it's not in alignment with modern medicine and modern food at all. Okay? It's really important to understand that. It's not in alignment with that at all. Okay? And because it's not in alignment with that, you need to start to rethink who you allow to tell you how to heal. I mean, I'm in a group with other healthcare professionals, and they were having a discussion. One of the physicians in the group was upset because one of the patients told her, "How can you tell me how to eat and you're overweight?" Now, I think that was mean of her to say that, but there's some truth in it. The truth of the matter is if you're on high blood pressure medication, how can you tell me anything about high blood pressure? We're in the same position. And I think it's really important, especially if you're going to be a healthcare professional, you need to be in the forefront of what you're preaching. You can't preach and then don't live up to what you're preaching. You understand? Like, many of our patients don't know what's causing them to be unhealthy. But if you're ignorant about that, and then you're sharing that ignorance with other people, you're endangering people. You understand? Like, it may be very unintentional, meaning, I mean, my last year at the hospital, working in the hospital, we had like a potluck at, in inpatient pharmacy. And, everybody bought different dishes, right? And one of the physicians bought a 7-cheese macaroni. Now think about that. He bought a 7-cheese, like, I don't even know 7 cheeses, but he bought a 7-cheese macaroni. I mean, it was so thick when you like rubbed the spoon through it, you could hear it across the room, right? And so I asked him, I said, "Man, you're going to eat that? Like, that's got to be dangerous to your heart, man. I know you got high cholesterol." And he goes, "So it's cool because I'm going to double up on my cholesterol medication." Okay. And that moment was like, damn, it's pretty damn scary out here. Like, if that's the thinking of somebody who's treating people, then we're in a really bad situation. And so that's what inspires me to keep going. That's what inspires me to say, like, I really want to help as many people as possible. Because the truth of the matter is that particular colleague of mine, they don't mean any harm. A lot of people think that doctors want to make money and they don't care about patients and they're trying to make them take things to harm them. It is not that. They just, like, we're not taught that. We're not taught this kind of stuff in school. Even the studies, when you get studies, like the studies that we get to validate using medications, those come from pharmaceutical companies. Okay? A lot of the studies that come that say you should have cheese and milk because it provides vitamin D, guess who sponsors those studies? The dairy industry. You understand? So many of the time we're getting studies, it's not the universities that are actually creating the studies. You know, the professors at the universities are carrying out the studies, but it's the pharmaceutical companies that are actually paying for the studies. Okay? So if the data doesn't come back the way they think it should be, they're going to stop funding the study. And a clinical study, just to give you some perspective, a clinical study will cost you anywhere from 10 to 20 to 30 million dollars to do an adequate clinical study. Like a gold standard clinical trial study could cost you up to $20 million. Okay? Schools don't have that kind of money. It is pharmaceutical companies that are sponsoring those studies. Okay? And so because they're sponsoring the studies, the results of those studies often come out in such a way that benefit the pharmaceutical companies. Okay, so it's really important to understand that. And a lot of people don't know how to read studies. Okay, because there's so many ways you can manipulate a study. Like, there's so many ways. I can change it from being a relative versus an absolute study. I can change the power of the study by taking the number of people in the study from 1,000 down to 100. Okay, there's so many things you can do to manipulate a study that people don't actually understand. You know, when you get data back from studies, the first thing I'm going to look at is who sponsored the study. If there's a conflict there where somebody sponsored the study and it benefits them to actually get results from the study in a way that would benefit the person who sponsored the study, I just throw the whole damn thing out. In my mind, I'd rather look at what's called experimental data. I'd rather, look at the 1,000 people that I've worked with individually, all the questions that I've asked them and said, hey, how many bowel movements do you have today? By the way, on average, most people are having like 4 bowel movements a week. Okay, so think about that. I'd rather look at my own data and say, this is what's reality for me and the people I work with, versus using data that comes from somebody who is biased. Okay, so there's so many things out there that are being taught to us, that are being shoved to us, and we're being told that it's making us healthy. Okay, but it is not the truth, and that's why it's so important for people to become empowered and for you to take back your health. You should be your first doctor. And what I mean by that is, you know what's going on in your body before anybody does. You know when something's wrong. Nobody else can tell you when something is wrong or right, but you know when something's wrong. Okay? And so you have to be your first doctor. You can't walk into somewhere and not have sort of really evaluated yourself before you walk into somewhere and now somebody's evaluating you and telling you this is what's going on in your body in big words that you don't understand, and shoving drugs at you that you don't know what type of side effects they have. Because the worst thing you want to happen is to be on the other side of, if you took this drug in 2020 or took this vaccine in 2020 and was injured from it, please call this number. You don't want to be on that side of it. You don't want to be on that side of it. I guarantee you the money is not worth it. Okay, so be your first doctor. You need to be your first doctor, because if you're not your first doctor, then you're throwing your health into the hands of no man's land. So, Happy New Year to everybody. I hope that, sharing this perspective really helps people. I think this is a great opportunity, a great time to detox, wash away 2020. So if you're interested, please click the link in my bio or go to drbobbyprice.com to learn more about my book, Education Over Medication, learn more about my detox program. And I think that's really a great way to start your health. So until the next time, peace and blessings. Happy New Year. I hope this year is fruitful, prosperous, and peaceful for all of you guys. So until the next time, Godspeed.